Now, almost we come to the end of the perineum topic. Now, two more small topics pending in this region. One is we're going to discuss about pelvic diaphragm, and we're going to discuss the nerve of perineum, parental nerve. That's all. So now we're going to discuss about the levator muscle. Levator muscle, it is a part of pelvic diaphragm. So first, know some basics. So, what is pelvic diaphragm? What is pelvic diaphragm? See, pelvic diaphragm is nothing but it is the muscular partition at the pelvic outlet. It is the muscular partition at the pelvic outlet. Okay, right. Now, what are the components of the pelvic diaphragm? See, pelvic diaphragm is having two parts. One is levator ani muscle, and another one is ischio-coccygeus muscle. Ischio-coccygeus muscle, also known as coccygeus muscle. Okay. So these two are the parts of levator ani muscle. Very important. The point is, pelvic diaphragm includes levator ani muscle and ischio-coccygeus or simply coccygeus muscle. Okay. The point is, ischio-coccygeus, it is not the part of levator ani. It is a separate muscle. It is not the part of levator ani muscle. Ischio-coccygeus, it is the separate muscle. It is not the part of levator ani muscle. Please remember that. Okay. Very often we are getting this question. All the following are the parts of levator ani muscle except. Again, levator ani topics very important for the INCT exam. In AIIMS and INCT exam, repeatedly we are getting questions from this area. Okay. Right. So, ischio-coccygeus, it is not the part of levator ani muscle. Now we have subdivisions in the levator ani muscle. Levator ani muscle having two parts. What are those? One is our pubococcygeus. One is pubococcygeus, and next one is iliococcygeus. So we have pubococcygeus and iliococcygeus, part of levator ani muscle. Okay. Ischio-coccygeus, it is not the part of levator ani muscle. Right? So now here we're going to discuss about the levator ani muscle. Now, levator ani muscle origin, see the diagram. Now, levator ani muscle origin from three areas. Now, this is front side. This is a pubic bone. I am writing as P, pubic bone. Now, this is the pelvic surface of the pubis. This area I am talking about. The pelvic surface of the pubis. So, number one, I am putting number one here. So, that is origin from the pelvic surface of the pubis, the inner surface of the pubis bone. The pelvic surface of the pubis bone. Okay. And this muscle also takes origin from the tendinous arch. The muscle also takes origin from this tendinous arch, this white line. Okay. The tendinous arch. Number three, we have one small projection from the ischium bone, a sharp projection that is called ischial spine. Ischial spine. Okay. So now these are the three origin points of the levator ani muscle. Okay. Now what about the insertion? See the diagram. All these muscles, they converge to which bone? Coccyx bone. Okay. So insertion to the coccyx bone. Now see the diagram here. Now this diagram is nothing but superior view of the female pelvis. Right. Now why I am saying female pelvis? We are seeing three openings. Urethral opening, vaginal opening, and the anal opening. Okay. Right. So now here, this is our ischio-coccygeus muscle. I am writing as IC. That is ISC I can write. That is our ischio-coccygeus muscle. Okay. From ischium bone to coccyx. Ischio-coccygeus muscle, I told you already, that is not the part of levator ani muscle. Fine. Now just in front of the ischio-coccygeus muscle, we are seeing this one, that is iliococcygeus muscle. Now iliococcygeus muscle attaching to coccyx bone. Attaching to coccyx bone and anococcygeal raphe. So please write iliococcygeus muscle. This iliococcygeus muscle inserted to coccyx bone and also to anococcygeal raphe. Anococcygeal raphe. Okay. Now, in front of iliococcygeus, we are having pubococcygeus. Pubococcygeus insertion will differ. So, we have various subdivisions of pubococcygeus. Okay. Now, this is number 1. This is number 1. So, we're going to write the subdivisions of pubococcygeus. So, number 1, that is pubococcygeus proper. So, pubococcygeus proper means attached to coccyx bone, inserted to coccyx bone, and anococcygeal raphe. Anococcygeal raphe. Number 2. So, number 2, this part. I am talking about this part. Now, this part goes behind the rectum and anal canal and continues the opposite side and form puborectal sling. So, number 2 is puborectalis. Number 2 is puborectalis. Puborectalis, which goes behind the rectum and the anal canal and continues with the opposite side. Continues with the opposite side to form puborectal sling. Okay. Next, number 3. Number 3, I'm talking about these fibers. Now, see these fibers. Now, these fibers are attaching to the muscles of anal canal, the longitudinal muscles of anal canal. Now, these muscles are called puboanalis. Now, this is puboanalis. Now, puboanalis, these fibers, they merge with, they joins with longitudinal muscle of anal canal. Okay. Right. Number 4, talking about these fibers. Now, these fibers present on the either side of vagina and attached to one structure which is present between the urogenital opening and the anal opening. What is it? That is our perineal body. I'm writing as PB. That is pubovaginalis. Okay. So, pubovaginalis, which is present on either side of vagina, attaching to perineal body, which narrows the vaginal hiatus and prevent the prolapse. So, number 4, pubovaginalis, which is present on the either side of vagina, attached to perineal body, and which narrows the vaginal hiatus and prevent the prolapse, and thereby it prevents the prolapse. Okay. Now, instead of pubovaginalis in male, what is the counterpart? Puboprostaticus. In male, instead of pubovaginalis, what is present? Puboprostaticus. Okay. So, the various subtypes of the pubococcygeus muscle. Okay. Right. Shall we proceed? Now, only one thing is pending. Now, supply. Now, levator ani muscle is supplied by sacral plexus S3 and S4 fibers from sacral plexus supply the levator ani muscle. Okay. That's all about the levator ani muscle, pelvic diaphragm. Next, one last topic in the perineum, that is our nerve of perineum, pudendal nerve. The pudendal nerve, I told you it is the nerve of perineum. Fine. What is the root value? S2, S3, S4. Again, it's a branch of sacral plexus. Okay. It is the branch of sacral plexus. Now, what is the function of the pudendal nerve? I told you it's a nerve of perineum. Okay. So, what is the function? Sensory function or motor function? Both. It is the mixed nerve which carries sensory fiber and also motor fiber. Okay. Right. Now, what is the course of the pudendal nerve? See, pudendal nerve, the nerve is formed in pelvis as a branch of sacral plexus. Formed in pelvis. Now, the nerve leave the pelvis and enter the gluteal region. Enter the gluteal region and resting on ischial spine via greater sciatic foramen. See the diagram? The parental nerve, it is leaving the pelvis and enter the gluteal region and resting on ischial spine via greater sciatic foramen. Okay, right. Now, from here, the nerve passes through lesser sciatic foramen. Okay, and then enter the perineum. Enter the perineum. Okay, yes. This is the course of our parental nerve. Now, an important point is parental nerve is resting on one bony prominence. What bone? Ischial spine. So, if you want to give the parental nerve block, you are doing some procedures in the perineum. Okay. Now, you want to block the parental nerve. So, which bony landmark you use for parental nerve block? Very good. Ischial spine. See the diagram. So, for parental nerve block, the bony anatomical landmark, the bony landmark is ischial spine. So, ischial spine, it is a bony landmark we use to give the parental nerve block. Okay, because nerve is resting on the ischial spine. One last thing, what are the branches of the parental nerve? Branches we'll mark here and then we'll write. Now, branches are number one, inferior anal nerve or inferior rectal nerve. Number two, your dorsal nerve of penis in female clitoris, and then perineal nerve. Perineal nerve interdivided into superficial branch and deep branch. Okay, so we write the branches. So branches of parental nerve. Number one, inferior rectal nerve. Inferior rectal. In some books they are giving inferior anal. Both are right. Inferior rectal nerve or inferior anal nerve. Number two, dorsal nerve of penis in female clitoris. Number three, perineal nerve. Now, perineal nerve divided into superficial branch and deep branch. Now, deep branch is the motor branch which supplies all the muscles of perineum. All the muscles of perineum get the nerve supply from the deep branch of perineal nerve. Now, superficial branch is a sensory nerve which is also called posterior scrotal nerve. In female, it is called posterior labial nerve. Okay, right. So, these are the various branches of the parental nerve. Now, we're going to see the animation for the pelvis and perineum. Right. Now, first you have to know what is perineum, boundary of perineum. I told you perineum is nothing but it is the pelvic outlet. Now, just we're going to tilt the bone. Now, this is anterior. Now, anteriorly, that is our pubic symphysis. Okay, right. Now, this is posterior. Posteriorly, you see the coccyx bone. Okay, now this is posterolaterally. This is posterolaterally. That is our sacrotuberous ligament from sacrum to ischial tuberosity. Now, anterolaterally, you are seeing this line there. Now, this line, that is the connecting part between the ischium and pubic, ischio-pubic ramus. So, now this diamond-shaped fossa is our perineum, pelvic outlet. Now, we're going to draw one imaginary line connecting the ischial tuberosity of two sides. Okay. Now, we get two triangles. The triangle in front is called, yes, the urogenital triangle. Now, this is our urogenital triangle. We have drawn one imaginary line. This is urogenital triangle. And below that, this is our, yes, anal triangle. Right. So, now we are seeing, yes, the superficial perineal pouch. Now, the superficial perineal pouch, you are seeing the muscle here. That is our bulbospongious muscle. Now, this is our ischio-cavernous muscle. And this is our transverse perineae superficialis muscle. Now, these three muscles in the superficial perineal pouch in the urogenital triangle. Now, this is our perineal body. Now, in perineal body, almost all the muscles of perineum will meet except this fellow, our ischio-cavernous muscle. Ischio-cavernous muscle is not meeting at the perineal body. Very important point. Remaining all other muscles will meet. Now, can you see the membrane here? The white membrane, that is our perineal membrane. Now, we're going to remove all these muscles so that you can see the membrane clearly. Now we are seeing the perineal membrane. Now we're going to remove the perineal membrane so that you can see the deep space. Now in the deep space, two muscles are present. Now one muscle you are seeing clearly there. Now this muscle, what I am showing there, that is our transverse perineal profundus muscle, and we also have sphincter urethra muscle. So we have removed the sacrotuberous ligament, we have removed other muscles. So now we are seeing only the pelvic diaphragm. So pelvic diaphragm, please remember, that is a muscular partition covering over the pelvic outlet. Is that clear? Right. Now we're going to see the parts of our pelvic diaphragm. Right. Now what are the parts of our pelvic diaphragm? See there. That is our ischiococcygous muscle, iliococcygous muscle, and this is pubococcygous muscle. Three parts are there for our pelvic diaphragm. What are those? Our ischiococcygous, iliococcygous, and pubococcygous. Now, iliococcygous and pubococcygous, they are the parts of levator ani. So, levator ani muscle contains two parts only. What are those? Our iliococcygous and pubococcygous. Very good. Now, ischiococcygous, I think you know that it is not the part of levator ani. Ischiococcygous muscle, it is a separate muscle. It is not the part of levator ani. Is that clear? Now, this ischiococcygous muscle and the levator ani, together they will form the pelvic diaphragm. See the question carefully and then write. Levator ani parts means only iliococcygous and pubococcygous. Ischiococcygous, it is not the part of levator ani, but that is a part of pelvic diaphragm. I hope that is clear. Levator ani and the ischiococcygous, they together they will form the pelvic diaphragm. Is that clear? Now we are seeing one part. Now can you see this part here highlighted in yellow color? Now this part is going behind the rectum and continues with the opposite side. Now this part is called as puborectal sling. So puborectal sling, the puborectalis muscle continues with the opposite side behind the rectum and forms one sling there, that is called puborectal sling. Now we're going to see the pelvic diaphragm from the superior view. Okay, the superior view. Now again, this is our pelvic diaphragm. Okay, pelvic diaphragm. Now can you see this part here? That is our ischiococcygous muscle, not a part of levator ani. This is our iliococcygous muscle and this is our pubococcygous muscle. Okay, right. Now can you see this muscle here, the lateral wall? That is our obturator internus muscle. Now the muscle which I am showing there, that is our obturator internus muscle. Yes, that is the obturator internus muscle. And you are seeing the demarcation line between the levator ani muscle and the obturator internus. That is the tendinous arch. You are seeing the white line now. There is a tendinous arch of the obturator fascia. Yes, there is a tendinous arch. Now we are going to see the course of the pudendal nerve. Now pudendal nerve is a branch of sacral plexus, root value S2, S3, S4. See there? This is a pudendal nerve. You are seeing there. Pudendal nerve is passing through this fossa. Can you see the fossa there? That is our greater sciatic foramen. Now in the greater sciatic foramen, one muscle is passing. Which muscle? Our piriformis muscle. So now pudendal nerve is passing below the piriformis muscle and which is resting on this bone. That is our ischial spine. Very important point. The pudendal nerve is resting on the ischial spine. 2019 November AIMS exam question. Now after that, the pudendal nerve, which in turn passing through this canal. Now this canal is called, that is our pudendal canal. That is a pudendal canal. It is extending from the lesser sciatic notch up to the deep perineal pouch. That is our pudendal canal or Alcock's canal. Okay, that is our pudendal canal or Alcock's canal. Now we're going to see the branches. Now this is our inferior rectal nerve, branch of pudendal nerve. Now we're going to see some more branches. Now this is our dorsal nerve of penis, in female dorsal nerve of clitoris, and this is our perineal nerve. Now perineal nerve divided into this branch, superficial branch, and that is a deep branch. Okay. Now the superficial branch is also called as posterior scrotal nerve, in female posterior labial nerve. These are the various branches of our pudendal nerve. And by this, yes, we are completing the perineum topic. Again, I am telling you, perineum topic is a very important topic. In all the exams, FMG exam, INSCT exam, NEET exams, we are getting 2 to 3 questions from this topic. Okay. Now we're going to start the discussion about the prostate gland and the prostatic urethra. Now for this topic, we have to know some basics about the trigone of the bladder. See, trigone of the bladder, I told you in the development itself, the only part of the urinary bladder which is not coming from endoderm. The trigone of the bladder, it is the small triangular area which is present inside the bladder. I am marked as 0, that is a trigone of the bladder. It is the only part of the bladder which is formed due to the absorption of mesonephric duct. Mesonephric duct, paramesonephric duct, they are all coming from mesoderm, intermediate mesoderm. So trigone of the bladder, it is a only structure which is not coming from endoderm, it is the mesodermal structure. Okay, right. First point, it is a mesodermal structure. Now, in the trigone, you don't see any fold, no mucus fold, no rugae. You don't see any rugae in the trigone of the bladder. Why, sir? Because in the trigone, we have no submucosa. The submucosal layer is absent. So the mucosal layer will be tightly attaching to the underlying detrusor muscle. So the mucosa, it is tightly attached to the underlying detrusor muscle. So we don't see any rugae, we don't see any mucus fold, okay, in the trigone of the bladder. Okay, so trigone of the bladder, it is a mesodermal structure, no submucosa. Because of no submucosa, you don't see any fold, you don't see any rugae, because the mucosal layer will be attaching to the underlying muscular layer. Fine. Now, this trigone, which extend into prostatic urethra and forms urethral crust. Okay, so the trigone of the bladder, which extend into prostatic urethra and form urethral crust. This itself a question. Urethral crust is derived from. So urethral crust is nothing but it is the extension of trigone of the bladder, which is the extension of trigone of the bladder into prostatic urethra. Okay, right. Now this urethral crust expand and forms colliculus seminalis or seminal colliculus or verumentanum. I'm talking about this structure. So this urethral crust expanded to form a colliculus seminalis. Okay, so please write the urethral crust expand to form seminal colliculus or colliculus seminalis or verumentanum. Okay, right. Now, in the seminal colliculus, we are seeing some openings. How many openings we are seeing? See the diagram? We are seeing 3 openings. We are seeing 1, 2, 3. And this itself a question. Total number of openings in the colliculus seminalis, 3 openings present. So in the seminal colliculus, we have 3 openings. Okay, 2 openings of ejaculatory duct. 2 openings of ejaculatory duct. So 3 openings, 2 openings of ejaculatory duct and 1 opening of the prostatic utricle. 1 opening of prostatic utricle. Okay, prostatic utricle. So now in the seminal colliculus or verumentanum, we are seeing 3 openings. Now in 3 openings, the 2 openings, one on either side for the ejaculatory duct and another opening is for the prostatic utricle. Now ejaculatory duct, I told you again in the development itself, the vas difference, epididymis, seminal colliculus, ejaculatory duct, they are all coming from mesonephric duct. So ejaculatory duct, it is a derivative of mesonephric duct in male. Vas difference, epididymis, vas difference, seminal vesicle and the ejaculatory duct, they are all coming from mesonephric duct in male. Okay. Now what about the prostatic utricle? See, prostatic utricle, it is nothing but it is a blind diverticulum. It is a cul-de-sac, a blind pouch. Okay, it is a blind pouch. a diverticulum, a blind diverticulum. Okay. Now, this prostatic utricle is coming from, very good, paramesonephric. I told you, development itself. It is a derivative of the paramesonephric duct in male. I told you, mesonephric duct forms male internal organs. The paramesonephric duct in male regress and forms some remnants. Which one? Our prostatic utricle. Okay, so prostatic utricle, it is a blind pouch or a cul-de-sac, which is nothing but a remnant of paramesonephric duct in male. So these three structures, these three openings are present in the seminal colliculus. See, this itself a question. Total number of openings, 3 openings, 1, 2, 3, 4. Likewise, they give. Very old, neat question. Okay, right. So now we're going to connect. So now we're going to discuss prostate gland. So first, we're going to discuss, see, this part of prostate gland. So we have prostate gland between prostatic urethra and ejaculatory duct. So that part of prostate gland is called median lobe of the prostate. Median lobe of the prostate. The median lobe of the prostate is present between anteriorly prostatic urethra. Anteriorly prostatic urethra. Okay. Posteriorly ejaculatory duct. Posteriorly ejaculatory duct. Okay. Right. So this is a median lobe. Now the base of the median lobe, which extend into the bladder. See this one. This is the median lobe. This is the prostatic urethra. This is prostatic urethra. And this is ejaculatory duct. And this part is the median lobe. I am writing as ML. Now see the apex of the median lobe. Now the apex of the median lobe, which goes into the bladder, is a tongue-like projection present inside the bladder. That is called uvula vesicae. So uvula vesicae, it is nothing but the tongue-like projection of median lobe in the bladder. So the median lobe of the prostate, the tongue-like projection which is present inside the bladder, which goes into the bladder, that part is called uvula vesicae. Vesicae means, bladder. Uvula means tongue-like projection. Okay. So uvula vesicae is a part of median lobe. 2020 NEET exam, they gave this question. Not 2019 NEET exam, we got this question. Okay. Uvula vesicae is a part of. Okay. Right. Next one. Now, in the case of BPH. So BPH is most commonly seen in median lobe of the prostate. Median lobe of the prostate. Okay. Now, the case of BPH, this median lobe is enlarged. This uvula vesicae is enlarged, which in turn leads to stagnation of urine. The patient is not able to completely empty the bladder. Okay. Okay, sir. Now, what are the other lobes? Now, other lobes are, now we're going to take the cut section. Now, this is the prostatic urethra. The prostatic urethra is the crescent shape in the cut section. Okay. Now, just now I told you, behind the prostatic urethra, this is anterior, this is posterior. Now, behind the prostatic urethra, I told you which lobe? Which lobe? Yes. That is our median lobe of the prostate. That is median lobe of the prostate. Now, this is a prostate gland. Okay. Cut section. Now, laterally, we have lateral lobes. This is the lateral lobes. Okay. We have 2 lateral lobes. Now, the lateral lobes which continues behind posteriorly and they form posterior lobe. Again, lateral lobes continue in the front side, that is called anterior lobe. Now, anterior lobe, they lack the glandular part. So, anterior lobe does not contain the glandular part. So, anterior lobe just simply connect the 2 lateral lobes and that part is called isthmus. Isthmus, nothing but that connects the 2 lateral lobes in the front side. So, totally we have what anterior lobe, 2 lateral lobe, 1 posterior lobe, and 1 median lobe. Totally 5 lobes are present. Okay. Now out of 5 lobes, the anterior lobe does not contain any glandular part. So anterior lobe also called as isthmus. Okay. Right. But recently, the prostate gland is described in terms of zones. So what are zones? How are we going to describe zones? Number 1, transition zone. Now what is transition zone? Now see the diagram. We're going to zoom this diagram so that you can see the zones clearly. Number 1, transition zone. Now this is the urethra. Now this is the proximal part. This is the proximal part of the urethra. I'm writing as P and this is D. Okay. So number 1, transition zone. So transition zone which is surround the proximal part of prostatic urethra, which surrounds the proximal part of prostatic urethra, which surrounds the proximal part of prostatic urethra. Okay, right. That is the transition zone. Now another important point is BPH is most commonly seen in the transition zone only. Okay, right. Next, central zone. See, central zone is not surrounding the prostatic urethra. See the diagram? It is surrounding this is vas deferens and the seminal vesicles, and they join together to form ejaculatory duct. Very good. So central zone of the prostate which surrounds ejaculatory duct, Very important point is cancer is less than 2% only. It is not common here. Less than 2% only. Okay. But the carcinoma occurring in this region will be of a highly invasive type. Carcinoma, luckily it is very rare. Carcinoma, if comes in this region, that will be a highly invasive type because it erode all the neighboring structures. Okay. Right. Next one, peripheral zone. Now peripheral zone, again, it's surrounding the urethra only, but not the proximal part, distal part. So peripheral zone of the prostate, which surrounds the distal part of prostatic urethra. Okay, right. And carcinoma, more than 80% it is common. More than 80% carcinoma, yes, it is seen in peripheral zone only. Okay, that's all about the zones. And we have one more zone, anterior. I told you, anterior no glandular part, that is called anterior fibromuscular stroma. These are the various zones of the prostate. Okay, right. Now what is the counterpart of the prostate gland in female? Prostate gland present in male only. Now what is the counterpart of prostate gland in female? In female, instead of prostate gland, what they have? They have skin glands, paraurethral glands of skin glands. It is a counterpart of the prostate in female. Skin glands is the counterpart of prostate in female. Okay, paraurethral glands of skin or simply skin glands. Okay, right. So that's all about the prostate gland and the prostatic urethra. Again, very important topic for our PG entrance exam.